Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh. Hello everyone, how are you? Thank you so much for watching this video. In this video, I will inform you some important information for virus and parasite infection. So, from this video, maybe we can call as tutorial, you can prepare more and more very good enough for a counseling session or counseling practice. Okay, let's start this tutorial. The first one, we will talk about the virus infection. Okay, here I'll show you some very important or point information. Yeah, the virus infection can cause topical and systemic infection. Topical infection of virus usually in eye and skin. Virus can attack systemic organs such as lung, gastrointestinal, cervix, and the other. The important thing in virus infection is the transmission. Like a bacterial organism, virus can spread from one to another. So that there are several ways in controlling virus infection. For example, curative by giving agent antiviral and preventive strategy by keeping the hygiene and control the transmission. These strategies should perform together and comprehensively. So now let's see the curative strategy. Yeah. Here I need three curative strategy that can be done to treat the virus infection. The first one is antiviral consumption. So you should be used according to specific regimen for dosing. Of course, the antiviral must be complete cure and then appropriate duration. Okay, for the second curative strategy is the immunomodulation action. Yeah, use supplement or action that can help patient increase the immunity, such as vitamin C, vitamin D, and sufficient sleep. And then the other curative strategy beside antiviral and immunomodulation is drug combination. Yeah, this means for drug combination, the people or the practitioners from the health providers must be aware of drug interaction because sometimes antiviral is combined with antibacterial because of the secondary infection. So we have to pay more attention for drug interaction. That's all about the curative strategy. And then next to preventive strategy. Yeah, preventive strategy is control the disease transmission. Of course, from the control the disease transmission, hopefully the disease cannot be spread to other person. For example, using mask for COVID-19 infection and then using condom. Yeah, if the person want to do some wife and husband relation, this is especially for HIV infection. And then please do some healthy lifestyle. For example, like exercise, adequate sleep, monitor the disease regularly, especially for HIV. For healthy lifestyle, beside we modified lifestyle, please also check the CD4. And then for the COVID-19, for example, please check by the PCR test. Yeah. And then don't forget to arrange some dietary consumption or eating habit. Yeah. And then the third one, preventive strategy, is vaccine scheduled and please aware with the booster. Yeah, so for example, like COVID-19, we have to join the vaccine program and then get the vaccine to make sure our immunity uh, enough, yeah, to um, fight the virus. That's all about the no, no, I mean the virus infection. So let's move to the parasite infection. Yeah, a parasite is an organism that lives on or in. Yeah, the parasite can lives on or lives in a host organism and get its food from or at the expense of its host. There are three main classes of parasites that can cause disease in humans. The first one is protozoa, and then the second one is helminths, and the third one is ectoparasite. Yeah, please see here. The protozoa is microscopic and one-celled organism that can be free living or parasitic in nature. They are able to multiply in humans, which contributes to their survival and also permits serious infection to develop from just a single organism. Yeah, here are some example of the protozoa. From the Sarcodina, for example, is Entamuba, and from the Mastigospora class, for example, like Giardia, yeah, and then from the Ciliopora class, for example, is Balantidium, from the Sporozoa class, for example, is Plasmodium, yeah. For very detailed what the disease can caused by this protozoa, maybe you can search by yourself. Yeah, for the trusted research or reference you can see in the CDC. Okay, the second classes is helminth. Helminths are large and multicellular organisms that are generally visible to the naked eye in their adult stage. Yeah, maybe if you see the sentence, yeah, if you see the sentence in their adult stage, so that's mean, and I will review a little bit, yeah. So the helmet have not only one stage of their life, yeah, any egg stage, any larva stage, and we can see clearly with no anything tools accompany our eyes gitu ya. That's in the adult stage. Like protozoa, helminth can be either free living or parasitic in nature. Here are some examples for helminth: any flatworms, any thorny-headed worms, and then round worms. Okay, and after protozoa and helminths, there are the other parasite. There is ectoparasite. Yeah, ectoparasite, for example, such as ticks, fleas, lice, and mites. Yeah, attach, yeah, to the skin, and then a relatively long period of times. Yeah, there's the specific characteristic of the ectoparasite infection. Okay, after I inform you about what is the parasite and what is the kind of the parasite that can be found in the world, now I will inform you about the transmission of the parasite disease. Any five transmission ways or any any five aspect, yeah, that can contribute to the transmission. So the first one is animal, or we can call as zoonotics. Here I give you some example for animals like cows and pigs are infected with the parasites such as Christosporidium or Trichinella, and then after that the meat, yeah, from the cows or pigs uh, will be eaten by the human, and then that will be make some risk factor or contribution to the infection in the human. Yeah, there is one example for the animal transmission, and beside farming animals, uh, also pets can carry and pass parasite to people. Yeah, for example, like cat and dog. Yeah, maybe there's will be some um, way, yeah, to get the infection in the human. Okay, and then the second transmission is from the blood. The parasite can be found in the bloodstream in infected people. So if the infected people give or will be the donor blood, yeah, in the blood transfusion, so it's will lead it's and will be make some um yeah change, yeah, to give the parasite to a recipient of the blood in the transfusion process. Yeah. Okay, and then the third one is food. Here I write some species or some individuals, yeah, in individual species, I mean, yeah, not individual human, yeah. This is some species that can be parasites, um, microorganism that will be infect the human. Yeah, for example, like Cryptosporidium, and then Giardia, and then roundworms such as Tricella, and then tapeworms such as Diplobothrium and Tinea, yeah, will be stay in some food. Yeah, I mentioned before in the animal, if the meat, yeah, I mean, yeah, the meat from the cows not cooked enough, yeah. Also, beside it, from the fish, yeah, there will be the contribution to the transmission of the parasite disease. And beside that, any raw vegetables that have been contaminated by human or animal feces, and then from raw aquatic plants such as watercress will be will be contribute, yeah, to the transmission. And then the next transmission way is by the insect. An insect that transmit a disease is known as a vector, and the disease is referred to as a vector-borne disease. Insect can act as mechanical vectors, meaning that the insect can carry an organism, but the insect is not essential to the organism life cycle. Yeah, such as when house flies carry organism on the outside of their bodies that cause diarrhea in people. Insect can also serve as an obligatory host where the disease-causing organism must undergo development before being transmitted. Yeah, individual drinking waters can yeah, I mean next talk about the water. Yeah, parasite can live in natural water sources. Common global water-related disease caused by parasite include worm, schistosomiasis, amoebiasis, Christosporidiosis, and giardiasis. If individual drinking water contaminated with fecal matter containing the Entamoeba histolytica, can get amoebic dysentery. And an individual can get worm disease when they drink water that contains the parasite Dracunculus medenensis. And the other types, or the other disease, I will not describe about the disease, but just inform to you that the water is one of the transmission way to get uh, to be infected in the human. Okay, beside drinking water, maybe it's will you have to consent also, about the water, because any recreational water illnesses are recreational water illnesses are diseases that are spread by swallowing, breathing, or having contact with contaminated water for swimming pools, hot tubs, lakes, and also rivers or the oceans. So it will be some some risk factor to get the infected parasite. Okay, after I inform you about the transmission, uh, hopefully you can, um, yeah, take some conclusion, or maybe you can summarize what kind of the information that you need when you do some counseling, about the parasite infection counseling. Yeah, for example, uh, you can ask, to the patient or to the consumer when you do some counseling. Ask about the history of their sign and symptom. Yeah, and that sign and symptom, if leads to parasite, you can ask some risk factor uh, that I mentioned from the transmission. Yeah. For example, if in our case study that will be practiced in the Wednesday, about the maybe pinworm, you can ask to the patient how about the hygiene, hygiene history of the patient, and then after that, after you ask about the information, you must give important information also. For example, how to keep the hygiene. Of course, to keep the hygiene is by washing a hand with soap and water. Yeah, and then after that, you can give some suggestions, some information to prevent, to prevent, and then to, I think this table is to prevent, the second one is food. Please inform to the patient if got some parasite infection, especially by the worm that can stay in the meat, in the meat course. Please inform to cook the food or the meat. And then if want to eat some vegetables, please also make sure that the vegetables cooked well. And then after the food is ready to serve, after maybe before serve the food, make sure that the food covered enough, yeah, to prevent that flies can stay in the food, and then yeah, to prevent that flies bring some organism, yeah, to the food. Okay, and the other ways to prevent, uh, of of course, about the pet, yeah, make sure that if the patient have some one or two or more pets, make sure that yeah, the people must have or must go or must bring, yeah, the pet to the veterinarians, and then treatment about the poop, yeah, is promptly and disposed properly. Okay, and the fourth is about water. Yeah, the prevention in the water aspect is make sure that the water cooked enough, and then careful when swimming or when, yeah, stay in the hot tubs, yeah, please be careful. And then to prevent the parasite disease in the insect aspect, please avoid the insect bite, and then maybe can use the prophylaxis treatment. For example, if someone wants go to the endemic, please endemic malaria, I think it's best if take the prophylaxis, yeah. Okay, in our study case, that mention about the pinworm. So I think some information that can be given to the patient, yeah, to uh, yeah, to make the treatment much better. Yeah, it's focused to the hygiene, and then to the maybe to the food, yeah, but I think the focus more is to the hygiene, yeah, to stop the what is the name, to stop the other transmission, yeah. Please washing the hand with soap, and then warm water after using the toilet, changing diapers, and before handling foods is most successful way to prevent pinworm infection, yeah, is so the very important is washing the hands, yeah, with the soap. Okay, and then the people who are infected should shower every morning to help remove a large amount of the eggs of on the skin. And then showering is a better method than taking a bath, yeah, because if you stay in a bath, um yeah, it's worry, yeah, I think worry the eggs will be stay in the water, or maybe stay in the wall of the bathtub, yeah. Okay, and also infected people should comply with good hygiene practice, such as, yeah, I mentioned before, yeah, not only yeah, the people not infected, but also, yeah, the infected people must do some hygiene more and more, yeah, when the pinworm infection occurred, yeah. They should also cut fingernails, and then avoid beating the nails and stretching around the anus, yeah, avoid beating the nails, and some stretching around the anus. And then the institution or a daycare center and school can control of a pinworm, yeah, can be difficult, but mass drug administration during an outbreak can successful. So for example, if any children in the one family infected by the pinworm, it's best if the other children or maybe the other people in the family take the drugs also, yeah, to prophylaxis, to prevent the infection. So I think enough, yeah, for uh, the tutorial about the virus and the parasites infection. Of course, our hope is from this little bit information, what is the important information, yeah, can help you to prepare counseling in the good enough counseling, yeah. Okay, thank you so much, and good luck. Wassalamualaikum warahmatullahi wabarakatuh.